Well, this is a case study of 1 month-old married female, age 28 years, with a history of swelling of the abdomen slowly and gradually after the marriage. However, what we see is that this is the longitudinal section of the pelvis, and in this we can see that the uterus measures approximately 6.3 by 3.4 centimeter, is normal in dimension. This is the urinary bladder in longitudinal section. The myometrium is okay. Endometrial canal is central and clear. However, there is seen fluid in the pelvic cavity that is surrounding the uterus on all sides. Now, this is the transverse section of the uterus, anterior myometrium, posterior, and the central area is suggestive of the endometrial canal, and it measures approximately 4.0 centimeters. So, and you can see that the uterus is being surrounded by fluid at all sides, from all sides. This is the urinary bladder, and this is the fluid. So there is nothing wrong with the uterus in itself, but it is surrounded by fluid with septas. Note the septas. There are thick and thin septas. This is a thick complete septa. This is a thin septa, and this is also a septa. This is not a cyst, as you see when I move now. There appears to be a cystic area in the right adnexa, but why this is not a cyst, that I can see the posterior wall clearly. Secondly, there is no posterior wall enhancement, and there is fluid posterior to it, and when I move the probe, it changes its shape. So this is these are thick septas, complete septas. You can see these are complete septas within this fluid, which is occupying almost and it extends in the midline above the umbilicus. You can see it's reaching above the umbilicus, and then it expands on both sides in the paracolic gutter. This is the left paracolic gutter that I am showing you. This is the iliopsoas muscle, the left one, and it extends into the right paracolic gutter as well. Here it is. This is the right paracolic gutter, and you can see fluid. The iliopsoas muscle, the fluid, and roughly calculated. Just roughly calculated, the approximate volume of this loculated cystic area extending above the umbilicus and then expanding on, something around 2.2411 ml, means 2.4 liter, and when the surgeon is going to operate it, it's going to be even, it may come up to be up to 3 liters. So which is loculated cystic area occupying mid-abdomen, lower abdomen, and sparing the upper abdomen, with septas in the dependent region, with debris as well, as I will show you, and multiple tiny calcifications in it. This is a calcified area, tiny calcified area giving posterior shadow. These are all tiny calcifications, and there is debris also seen. As you see, this is the debris, all debris. Now this is the ovaries. If you ask to see the ovaries, now this in fact is an ovary. This is an ovary with an developing follicle in it, right-sided ovary. However, because of the pressure of the volume of this loculated cystic area, it's not possible to get the left ovary with confidence. So now you see this is again the septals, the left side, the debris in the dependent region, whereas the fluid in the this is the fluid in the loculated fluid in the paracolic gutter left side. No, this is clear of septal debris or any calcification. The fluid in the that expands towards the right paracolic gutter. This one is also free of. This is the fluid. This is the right iliopsoas muscle, and it's free of any aqueous debris or any other solid element. No solid element is seen. Also a little bit. Now let's see if there is any mass effect on the kidneys, because it does carry the. Now this is the kidney, left kidney. It's normal pivotal position. No significant hydroureter or hydronephrosis is seen, and this is the right kidney. Though minimal hydronephrosis is seen because of the pressure effect. This is the part of the fluid, loculated fluid, similar that we were seeing. So this is a multi-loculated fluid rather. This is the liver. No fluid is seen above the diaphragm. No pleuroperion is seen. This is the gallbladder. Now this is the kidney again. From here we can. These are loculated fluid pockets. Multiple loculated fluid pockets are seen in the abdomen. Upper part is relatively spared, and this is the pancreas. This is the pancreas, splenic vein as its marker, and this is the spiromesenteric vein. This is the aorta. This is the transverse section of the pancreas that you are seeing. There is no evidence of para-aortic adenopathy, and as well as there is no regional adenopathy seen. So this is a case of an infected loculated ascites, ascites, or a loculated large complicated cystic mass extending from the pelvis up to the anterior to the umbilicus in the mid region, and then expanding on the both paracolic gutters, which is also seen extending. A pocket of fluid is also seen in the Morrison's pouch, and here we are. This is the fluid pocket that you can see over here, with minimal mass effect on the mild effect on the both. On this side it's more, on the left side it's less mass effect is seen on the urine. This minimal hydronephrosis is because of the mass effect of the mass. Otherwise, there is no pleural effusion seen, no adenopathy seen. So this is a case of infective sonographically infective cyst. Thank you very much.